like that until next notice because I don't want to be, interrupting my regular routine from work.
Yeah, I mean, you're right about that. You're smart to keep that routine. The other thing you want to make sure you do, well, there's a few tips about working from home. You want to keep the same routine. So however you worked in your office is the same way you need to work from home. Some of the exceptions is that you have to give yourself a mental health break because the mind can only comprehend what the rear can endure. And you don't have the social interaction that you do at work. So you don't have your peers sitting in the cubicles next to you. You don't have the opportunity to walk over to your manager or to Jose or someone and vent or talk things through. You're kind of there on your own.
Yeah.
The other thing you need to do is give yourself that mental health break by getting up and taking a walk. So I have a dog named Herbie, and what I do is about every 2 hours, I get up and go outside with Herbie and we walk around my house. So we walk around the house 5 times, and then I come back in and go back to work. Another tip for you from working from home is give yourself goals that relate to an accomplishment. Over the years, a lot of times you hear people say, particularly with call centers, they'll say, make 25 phone calls and take a break, or 50 phone calls and take a break. I think that's not a great thing to do because we can get really good at smiling and dialing, particularly if you use a predictive dialer. So what I would tell you to do is set a time for either a talk time. So have a conversation for a minute or longer with 5 people and then take a 5-minute break.
Oh, wow.
And the reason I say that is if you have a conversation with someone for a minute or longer, you're probably going to end that phone call on a pretty good note, right? You'll either make a sale or you'll get a scheduled time to call back. But when you take your break, you will have actually accomplished something. And then when you take a break, before you get up from your desk and go walk off and take that 5 minutes for yourself, make a list. So make a list of the things that worked and make a list of the things that didn't work. Keep track. We talked about this on one of our calls before. Take a piece of paper and draw a line down the center of it. And on the left-hand side, write down the objections or stalls or the pushbacks you get from the prospect. And on the right-hand side, write down whether you hear that as an emotional or a logical one. Remember, we talked about emotion and logic. And what you'll find is you'll start finding a pattern. And the pattern is what we tend to set up because of our approach and the type of questions we're asking. And so during the day, what I tried to focus on is how can I interrupt that pattern and do something different with them. And then the last thing I would tell you to do at the end of the day, make a list of what you're going to accomplish the next day. That means that when you're working from home, make a list for the next day and set the time frame. Whether that is, I'm going to have 5 phone conversations of a minute or longer within the first hour of working, or I'm going to make 25 phone calls with 3 conversations of 2 minutes or longer between whatever time, 9 and 11. And then that gives you something to focus on. And here's why that's really important. The reason it's really important is because what we tend to look for when we're making phone calls, we tend to look for a sale, right? We tend to look for someone who's interested in buying from us. And as we've talked about, nobody's interested in buying from us. Nobody's interested in us. Nobody's interested in our company, and nobody's interested in our product. They're interested in themselves. Rather than looking for people that are interested in buying from us, let's look for people that are open to having a conversation with us. And that means that when we do get off the phone with them, we're in the groove. Like, there's nothing better in football than a receiver catching a pass, right? Because that wraps up the audience, it ramps up the team, it creates motivation. The other side of that is there's nothing better in football than when a receiver misses the pass, because then he's determined to go back and get it. And you have to decide, and you have to be honest with yourself about which one you are. If you're the kind of person that when you get that sale, when you get that person that engages with you, that motivates you to make that next call and find that next person, then you know that that's your stimulus. But if you're the kind of person that when you don't get the conversation, that you're determined to get the next conversation, then that's the stimulus for you. But when we're out there looking for people to buy from us, instead of people to have a conversation with us, then we're really narrowing our market down, because there's very few people, like the people that might buy from you on a med-sup that are like sitting there waiting with bated breath are probably the ones that just got a rate increase, right? And the people that will buy the Med Advantage plan to you are the ones who had a lot of out of pocket, or that's their past or their history, or they're really tight on money. That's kind of hard to find, because when you talk to them, they don't come right out and say, hey, thank God you called, man. I've been waiting for 3 weeks for an agent to call me so I can write them up. That probably doesn't happen. So you're right, Ronnie. It's a big challenge to work at home. Hello, everybody. We already started visiting a little bit. I'm glad you're on the calls.
Yeah, they're all connected already.
Yeah, we're just chatting a little bit about working from home. Anybody have any stories for me about working at home? Do you have any concerns about it? What's working good for you? What are you having a challenge with? Just take a minute or two to share that with me.
Hey, good morning, Lloyd. How are you? This is
I'm doing good,
Carlos. Hey, how are you?
What's up, buddy?
Yeah, today is fine, and you? Today is my third day here at home, and yeah, it's different. Like I was listening to what you were saying, and it makes a lot of sense. Yeah, it's a little bit different. The good thing is that I have a lot of work to do, so I've been focusing, trying to focus here. But it's a different story. I like to see my people and everybody smiling and everything. So hopefully this thing passes in the next few months.
Well, you know, I think you guys are really heroes in what you do, because not everybody is willing to work at home, and not everybody can work at home.
Right, exactly.
Margella, were you going to say something? Well, here's a few tips. We were talking about this when we first got started. Set up your workspace at home exactly like you have your workspace at your office. That means have the same things on your desk. Use the same resources if you can. I don't know what your system's like, if you can use the same resources. Make sure that anyone that lives with you knows that you're at work. It's real easy for them to know that you're in that other room and just to pop that door open and ask you a question. It's real easy for you to hear the kids, to hear something drop. Like my dog Herbie will bark when UPS delivers something. They delivered something about an hour ago, and I'm down here and you hear all that barking. And the stimulus, that, you know, my normal habit would be to go upstairs and make sure everything's okay. But my office is 40 miles west of here. I live in Conyers, Georgia. My office is in Marietta, Georgia. I wouldn't drive home to find out that UPS delivered something. So I'm not going to walk upstairs and find out if something delivered something. My wife is a competent and capable person. If she needs me, she'll come and tell me that. But over the years, I had to train my kids. Dad's at work. This isn't a time that I can't help you with the car or the toy, or I'm not going to break up fights with you. I'm not doing any of that kind of stuff. I don't care if there's a sale on. I'm not going to the store with you. You wouldn't drive to my office and ask me to go to the store with you. Don't come in my office and ask me here. So you have to, if you want your family to treat you like you're at work and this is a business and you're professional, then you have to act that way. And you know, what I always tell them is don't take offense where offense isn't meant. The other thing you need to do is set a goal. It is difficult to work at home. Here's what you're going without. Let's talk about what you're going without before we talk about what you're getting. You're going without the stimulus of the work environment. You don't have the things off the wall. You don't have the call log chart off the wall. You don't have the peer interaction. When you get off a phone with a jerk, you can't lean over to Armando and say, this guy was a real moron, because Armando's not there to go. It's like, man, I just had one too. You don't have that camaraderie. So you have to keep yourself motivated. And the way to keep yourself motivated is to set goals up that reward yourself. And I don't know about you, but I feel rewarded when I have really good conversations with people. I'll tell you something, this is kind of strange. I also get rewarded when I get rid of jerks. I would rather someone tell me in the first 2 minutes, I'm not interested, I'm sick of you people calling me, don't call me again. Praise the Lord, I don't have to waste my time with you. Mark my list, you're out of here, I'll never have to talk to you again. So set goals that are unusual and different. Don't set, I know that a lot of times people working at home, even in call centers, they'll set goals of, make 25 phone calls an hour, make 10 phone calls an hour. I would tell you to set creative goals. So Ronnie and I were talking earlier, you might set a goal that says, I'm going to have 5 conversations of 2 minutes or longer, and then I'll take a 5-minute break. Now, here's what happens. Sometimes that might sound pretty easy to do. But sometimes, particularly if you have a timer, like I would encourage you to have a timer and time your conversations. Sometimes we think we had a really good conversation with somebody, and the conversation lasted 45 seconds. And then when we look back on that conversation, what they really did is they got rid of us. Remember we talked about habits? They really just got rid of us. So set goals that are motivational, that are unique and are different. Track what you're doing. Take that piece of paper, draw that line down the center of the paper. On the left-hand side, write down the objection you're getting, or the pushback you're getting, or the stall you're getting. And on the right-hand side, write down whether it's an emotional or a logical one. And look for trends. Give yourself a break. Make sure when you, sorry, my allergies are really bad here right now. Make sure when you hit that goal, whatever the goal is that you set, get up and take a walk. Like I take my dog Herbie, every 2 hours I get up and I take Herbie outside and we walk around my house. It's about a half acre. We walk around the house 5 times, and then I come back in and come back to work. Does anybody else have any comments or insight about working at home before we get on with the presentation today?
Yeah,
Just
like,
oh,
I'm sorry. Yeah, I just
go
like
ahead.
to say, Lloyd, that this is Melissa. Good morning. Yeah, that it's, as you said, have your workspace just as you had it at work. And that's exactly what I did. I felt a little crazy. I'm like, should I be having it, but exactly at work? But that's what I put. I put the things I had on my wall at work. I have the same little, things on my desk. Like that's how I viewed it. When I came to put my workspace at home, I made it look like work. So it would feel like I was at work. And it's true, as you said, we have a 10-year-old son, and we've been coaching him on that too. When we're working at this time, of course he can come and talk, but we're really trying to stay in the mindset of working, our full day here.
Well, Melissa, I appreciate you sharing that with me. I'll tell you one way that you can help your kids that are that young adapt to you working at home is, as you set goals for yourself, set goals with your kid. So if you set a goal to say, when I have 5 phone conversations that last 2 minutes or longer, I'm going to come out and spend 5 minutes with you, or I'm going to come out and read this book with you, or I'm going to come out and make you a sandwich. And that way, and make sure you tell them how long you're going to be out there. And that way, when you accomplish that goal, it does 2 things. They're sitting out there just getting on with their day, but they're anticipating that interaction you're going to have with them. Instead of constantly bugging you because they want the interaction, they're anticipating it. It gives you a reward, because then when you walk out in the living room or wherever the kids are at, they're excited to see you because they know you hit your goal. And they know that they got their goal hit because you came out with them. And before you go back in the room, tell them what the next goal is. And then it's called tell, show, show. Tell them what the next goal is, and then have them tell you what the goal is. And then you, when you get done with the goal, you go out there and you show them what you said you were going to do with them. So that's how when we have young kids at home, that's how we can make the kids a part of it. And it breaks your day up. But here, be careful about this though. Keep track of your hours. It's really, really, really easy to get distracted. We don't want to hurt our kids' feelings. We don't want them feeling bad. We feel guilty. And the truth is, we are heroes to our family when we do our job. And we have a better interaction with our family when we've had a successful day. And you're modeling to the kids how to be a success in work, in family, and in life. So I'm really proud of you, Melissa. It's really hard to do when you have young kids at home. I did that when I was raising my kids.
Thank you, Lloyd.
All right, anybody else have any comments or input before we jump on the? No? All right.
Yep.
Let's jump on here. Share my desktop. Get rid of all this little puppy stuff. Today we're going to talk about people on the move. We've spent a few weeks going through the mechanics of selling. We've talked about habits and relationships, building conversations. I want to back up just a little bit and let's talk about the market again, the population again. As always, you can email me, lloyd@lloydlofton.com. You can call my desk number or you can reach out to me on the cell phone. I would ask you, if you email me, make sure you copy your manager on it, because when I email you back, I will copy your manager. I know that one of you emailed me a script and I haven't responded yet. I'm going to do that today in the call, if that's okay. So people are on the move. Let's just kind of break down the baby boomer market again. We know that the silver tsunami started in January of 2011. The baby boomer generation is defined as those individuals that were born from 1946 into 1964. That's the baby boomer generation. And there's different estimates. Somewhere between 76 and 78 million people were born during that time. That was 40% of the population. Now think about this. That was 40% of the population in 1964. Social Security became law in 1935. The first tax for Social Security was levied in 1937. Ida Mae Fuller received the first check. Her benefit check she received on January 1st, 1940, after she paid in the system for 3 years. She lived to 100 and she received $22,088.92 over a 35-year period of time. The first person to receive a Social Security check as a baby boomer was Kathleen, I can't even say the last name, Casey Kirschling. Her birth was 1 second past midnight on January 1st, 1946. That's when she was born. She took early retirement in 2007, got her first Social Security check. So there's a few things that we know. We know that during 1946, 1964, 92% of women that could have a baby did have a baby. We know that the average family between 1946 and 1964 had 4 children. And we know that 2 times the previous birth rate is how many babies were born. That generation hit every stage of life together. From 1946 to post-World War II, there was 3,411,000 babies that were born. That's the number of babies born in the U.S. in 1946. That's 9,345.2 per day, 389.38 per hour. 6 a minute were born in 1946. That's a lot, right? As the soldiers came back from World War II, communities, rural communities started turning into suburbs. The first mass houses were built in Levittown, USA, starting in 1946, and that's where the soldiers lived when they came back from World War II. In 1954, 4 million babies were born. 11,000 a day, 465,000 per hour, 7 a minute. In 1957, 4 million babies were born. 11,780, 490 per hour, 8 a minute. Wouldn't that have been a great time to be in the market? Wouldn't that have been a great time to start a business? Maybe start a diaper company where you sell diapers. Maybe you sell baby food, toys, bicycles. It would have been a fantastic time to be in business, because what a great market. We know what every couple was doing during that period of time, don't we? Industries were created and fortunes were made as companies positioned and repositioned themselves to serve this demographic. I want you to take just a second to think about that. As these 78 million babies were being born and raised over that 18-year period, companies positioned and repositioned themselves to benefit from that demographic. Baby boomers bought mouse ears, hats to wear while they watched Mickey Mouse, coonskin caps to wear while they watched Walt Disney TV specials about Davy Crockett. They bought rock and roll records. They danced to American Bandstand, Elvis Presley. They collected hula hoops, frisbees, Barbie dolls. Millions watched Wild Kingdoms, which was sponsored by Mutual of Omaha. And starting in January of 2011, these baby boomers over that 18-year period started turning 65. Approximately 2/3 of all seniors 65 and over, and 60% of those 50 to 64 have at least one chronic disease. 8 trillion will be inherited by boomers from their grandparents and their parents and other people. That's a huge market with huge opportunities and huge needs. If we project forward, in December of 2019 or 2029, the last of the boomers are going to turn 65. That 65 population segment is going to double to 71 million by 2030, and it will grow to 86 million by 2050. You could have 80 million plus being on Medicare and Social Security over the next 30 years. You're in the right business, you're in the right market, and you have the right products. So when we talk about having an unlimited opportunity, it is a pool of people that are looking for answers to those problems, just like their parents were a pool of people looking for answers to the challenges they had of having 4 kids and families and raising them over that 18-year period of time. In fact, the baby boomers are the first generation to be studied so intensely by marketers. That's why we know so much about them. Going all the way back to the seminal Newsweek article of August 9th, 1948, "The Population Babies Mean Business." And that is the same today. Seniors mean business. Everything about the baby boomer demographic has been predictable. As history's taught us, the beginning of World War II and the ending of World War II told us that as they age into this twilight period of their life, they're all going to have the exact same needs. So the people that went into World War II and came out of World War II over an 18-year period of time had the exact needs. They needed a job, they bought a house, they had kids, they bought baby beds and diapers and tricycles. They entered their kids in Boy Scouts and Girl Scouts. They took their kids on camping vacations. They entered their kids in elementary school, junior high, high school, and colleges. They all had these same life experiences. And over this 18-year period that they're going to be entering retirement age, this twilight period of their time, they're going to all have the exact same life experiences. And we already know what those experiences are. We know what they're going to buy. We know when they're going to buy those things. We know what the products are and what they're going to cost because they're filed in every state. We know where they're going to get the money to pay for it. And we should know how to help them predict the needs and problems that they're going to want to solve as they age. Just as these people were born 18 years of each other, they will retire within 18 years of each other. In fact, the government might even do our industry a service by continuing to push retirement out more. Right now, retirement is 66 and 8 months. Some people are not retiring until they're 70 or older. That means that the needs of the pre-retirees will be extended and the needs of the post-retirees will be more concentrated. There's a real possibility that people could spend as many years in retirement as they did in the workforce. When you're talking to them about a solution to their healthcare problems, that premium that you talk to them about isn't just the premium they're paying today. That's a premium they could be paying for the next 25 years. And if you don't talk to them about that possibility, you're going to be finding that their business will constantly churn because other people are going to buy their business with low premium stuff, that the rate's going to go into double digits. They're not going to be able to afford it. They're going to have health issues and can't switch plans. There's a whole bunch of stuff that's going to go on. We have to have that conversation with them. Many will be looking at an encore career. A lot of seniors are getting part-time jobs to supplement their income. Those are the conversations we want to have with our clients. And thanks to the advances in medication, the boomers wave isn't just about post-65. Between 2020 and 2039, boomers will expand the 75 and over population. This is something I've fought with agents for years about. They're looking for that turning 65 because it's a guaranteed issue. People are going to buy the meds up anyway. They're going to get that supplemental plan anyway. But the people who really are looking for answers and have issues that they want to solve are those people that are expanding their retirement age. The government just changed the required minimum distribution on qualified money from 70 to 72. There are great opportunities right there where people have the funds now to buy the products to solve their problems. Between 2030 and 2049, those 85 plus will climb 113%. But Lloyd, they're not going to be able to afford to buy the products. But Lloyd, they won't have the health to qualify for these products. Exactly. You're exactly right. And that's why you need to have the conversation now. In mid-century, 65 plus will outnumber age 15 and younger. These people are going to have long-term problems and issues. And remember, we talked about this before. They already know about a lot of this stuff. In fact, a lot of times the only person that this is new to is the agent. Our peer group tends to be within 5 years of our age. So if you're talking to someone who's 65 years old, they already know somebody that's 70 years old and has gone through exactly what we're talking about. They already know this. The problem is that most agents that talk to them only talk to them about the turning 65 issue and the premium for the product they're buying today, not the lifestyle problem they're going to have as they age. So we said we already know what they're going to do, right? So as people age into retirement, we know they're going to sign up for Social Security. We know that they'll automatically be enrolled in Medicare. If they're going to continue to work, they'll opt out of Part B of Medicare. We know that 80% of those are going to buy some kind of supplement. We don't know if it's a Med Sup or Medicare Advantage. We do know, based on the script, the 4 things script that we've gone through, that we can put them in a funnel and we could get a pretty good feel for what kind of product would meet their needs. But there are things that are predictable. There are things that we already know about it. Let's talk about a couple more things. So we know when someone gets on Medicare that they're already paying for health insurance. If the male's turning 65 or 66, his wife is 62 or 63, they're already paying $18,000, $25,000 a year for health care. Even if they have group coverage, they're paying dependent coverage. So they're already paying $8,000, $12,000, or $18,000 out of their pocket for dependent coverage. So we already know that about them. We know that they're going to reposition 2,000 of that or so and move that over to get a supplement for the person turning that 65 or 66, most likely the male. We know when they do that, they're going to come off the health plan, and the spouse is going to need her own standalone health plan. We know where she's going to get the money to pay that because it's the money left after they pull the $2,000 out to pay for the husband's supplemental plan. We know what both those products cost because they're filed in every state. And we know that in 3 or 4 years, she's going to age into retirement. And she's going to reposition the money she's spending on her health plan over into her own supplemental plan. And in both of those scenarios, for the husband and the wife, that leaves money on the table that can help fund a final expense. And in our webinar, on the next webinar we do, we're going to talk about that presentation. So we already know, everything's already predictable. We already know what's going to happen, when it's going to happen, what they're going to buy, when they're going to buy it, what the product costs, where they're going to get the money from. We already know this stuff about them. We also know that older individuals often live on a fixed income. That means if they're retired, they don't have the time or resources to make up losses. That's important to keep in mind. As we talk about final expense on the next call, you're going to hear people tell you they can afford the funeral, they don't need it. And they may be right, but there may be things they're not thinking about. Because when they're on a fixed income, when they pull money out of savings or other things, they don't have time to replace that money. But we'll talk more about that. They can pay a sizable portion of their income in physician fees and pharmacy costs. And so a lot of those plans, particularly in the Med Advantage plans, there's maximum out-of-pocket cost that people just don't consider. And the reason they don't consider it is because agents, unfortunately, tend to sell with the shiny object syndrome. And that shiny object syndrome is zero premium. But we know it's not zero out-of-pocket. We know that in their worst health year, you know the script, right? Every one of you should know the script. In their worst health year, as they age, they get less healthy, not more healthy. We know in their worst health year, their medical expenses become more expensive, not less expensive. We know in their worst health year, they're going to have to pay that money out of somewhere anyway. Agents need to be selling anyway, not the shiny object. Because they will pay a sizable portion of their income in physician fees and pharmacy costs. For others, long-term nursing care or hospice care is going to be a major burden. I know they think it's not going to be. I get that. But it's your responsibility to have that conversation with them before they need it, because you can't help them after they require it. Everything we do involves life cycles. And I just wanted to show you this chart here. Small business employees 0 to 18. So this would be dependents and people working part-time at McDonald's and stuff. We know what they need: health insurance, life insurance, critical illness, association benefits. We know what families need: health insurance, life insurance, critical cancer, critical illness, association benefits. We know what pre-retirees need. They need the short-term care. They need short-term medical. They need critical illness, health insurance. And we know what the retirement people need. They need final expense, cancer, critical illness, association benefits. They need all that kind of stuff. What's the red line between all of these? They all have the same type of needs. The importance of fulfilling those needs and meeting those needs is just different for each age group. So we talked about this. A male turning 65, going to sign up for Social Security, or 66, depending on when his retirement is. He's going to automatically be enrolled in Medicare. He's going to get some kind of, 80% are going to get some kind of supplement. That's the perfect time to sell that final expense product for him. With the money left over, the wife's going to need her own standalone health plan, whether it's a major med or a simplified issue plan, maybe a critical illness, a final expense plan for her. She's got the money. She's got the money because we just took the husband off the plan. At 65, she's going to age into Medicare. We know that the average Social Security check, go to socialsecurity.gov right now, you see the average Social Security check is $1,609. We know that the average retirement check, FIRMA tells us that, the average retirement check is about $1,200. That's $2,800. We know that the average spousal Social Security check is $900. And here's what the other thing we know: when the husband dies, the wife has a choice. She can keep her Social Security check or keep her husband's Social Security check based on a formula. Most of the time, they're going to keep the husband's Social Security check because it's more than theirs. But when she does, she's making a conscious decision to live on $10,800 a year less income. The first year her husband died, it's the most emotionally devastating time in her life. She's making a conscious decision to live on $10,800 a year less income. She's choosing to give up $108,000 in income over the 10-year period. And agents tell me it's hard to sell final expense. I don't think so. It's hard to have that conversation because we have been trained to think it doesn't fit in with a mess up or net advantage presentation, and that's wrong. That's a disservice to the public that we work with. We know there's 4 things seniors are concerned about. We know they're concerned about hospitals, doctors, prescriptions, recovering home after a procedure, not leaving a financial burden to the family. In fact, we're going to end this part of the presentation shortly, and I want to get some feedback on everyone on the 4 things script and how that's working for you and what you're running into. So what's the message? If you market yourself as amazing, astounding, spectacular, they hear blah, 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 because that's what every other product hawking, price hawking salesperson is telling them. To stay relevant with the coming 76 or 78 million baby boomers, you got to do 3 things. I'll give you a second to get your pen out so you can write these down. 3 things. Pull them towards you with true perspectives and values rather than pushing your product and services with hype. You got to have 1 million experiences that you've heard from your customers. You've got to have 1 million situations that your clients have told you about. So sell the problem they have with the stories you've helped your customers solve. Identify the challenges to your message and address them directly. Ego stunts your growth. Don't get in the way of your own progress. Be willing to change. Listen to your own conversations. Keep notes of the things prospects say to you. Are they emotional? Are they logical? Close on minor points. All these things we talked about over the last few weeks. And be transparent. And when I say be transparent, that means be concerned about them. Let them know that you are licensed for all the products in your state or in their state, that you want to look up the products that will meet their needs the best. And here's the kicker that agents never tell their customers, and should, to set up your call for next year. In fact, today, each one of you should have a minimum of 15 people that you told last year that you would call today. And the reason for that is they bought a plan from you last year on this date. And you should have already figured out what their rates are and called them and told them if they were on the best plan or how you can get them on the best plan. So rates change all the time. You should already be doing this. That's being transparent with them. And the other thing it does is it keeps other agents out of your home. So every conversation, you should end it with what you're going to do for them in the next 9 to 12 months. Betty, let me ask you a question. What objection do you have if I contact you in the next 9 to 12 months and let you know if there's any rate increases or if there's policies that you can get at a better rate? What objections do you have if I call you about that? Betty's going to tell you 80% of the time, no, that'd be great. And mark your calendar. Like if you have their email information, you should email them the week before you're going to call them and remind them that you told them you're going to call them. And then start the conversation. So we are in 2020, got the pandemic going on. Lord knows you hear all kind of crazy stuff from all the different news channels, all the different pundits, all the different social media marketing, all the different posts on social media, all the different articles in the paper. Who in the heck do you believe? What do you do? My God, it's crazy. People are confused. It's all get out. How do you start the conversation? Well, here's the symptoms of COVID-19. Can range from mild symptoms to severe illness and death. Symptoms can appear 2 to 14 days after exposure. The things you have to watch out for is fever, cough, and shortness of breath. And there's a public service message we could give people when we talk to them. 8 out of 10 deaths are reported in the U.S. have been in adults 65 years and older. That could be a lead in their conversation. Among adults with confirmed COVID-19, 31 to 70% of adults 85 years and older require hospitalization. 31 to 59% of adults 65 to 84 years old require hospitalization. The estimated percentage requiring admission to intensive care unit, 6 to 9%, 29% of adults 85 and older. 31% of adults 65 to 84 years old. So let's just stop for a minute, okay? Let's just be honest with each other. And we're salesmen. Our job is to solve people's problems. So we have to get rid of this nonsense of, well, I don't want to take advantage of people during this crisis going on and blah, 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 blah. If I have a Med Advantage plan with a maximum out of pocket of $6,700 in my worst health year, and 31 to 70% of adults 85 and older require hospitalization, or if 6 to 29% of adults 85 and older require hospitalization, or 11 to 31% of adults 65 to 84 years old require admission to an intensive care unit, what's the likelihood they're going to hit that out of pocket if they get the virus? See, that's a conversation to have with somebody, right? And is that what they're expecting? And where would they get the money to pay for that? Would they take it out of their savings? Would they take it out of their retirement? Would they take it out of their Social Security? Would they have to take a second on the home? Would they have to sell something? Would they have to borrow money from the family? That's a conversation now. 10 to 27% of adults 85 and older died from it. 4 to 11% of adults 65 to 84 years old died from it. You are not taking advantage of the pandemic, of the situation, when you talk to people about the things that impact them and their family, and they're worried about it. Your job is to disturb them. Your job is to create discomfort. Your job is to talk to them about the things that matter most to them. And do it in a professional, matter-of-fact way, just like your doctor does. Your doctor doesn't come in the room and tell you you've got pneumonia like, oh, gee, man, I'm really sorry. I hate to tell you this. Your doctor comes in and bed. We know what's wrong with you. You got pneumonia. Here's what we're going to do about it. Write your prescription, tells you to take this twice a day for 10 days. Come back and see me in 10 days, right? And we respect the doctor when they do that. There's a difference between empathy and sympathy. Sympathy is I understand how you feel. I feel the same way. I don't want you to feel bad, so I'm not going to bring it up so you don't feel bad, and then I don't feel guilty for making you feel bad. That's sympathy. That is a career killer in our business. Empathy is I understand how you feel. I felt the same way. I've had clients who felt the same way, but the facts don't matter. The fact that you're going to feel uncomfortable about this don't matter. Here's what you need to do. And just be matter of fact about it. Because those are the numbers. That's from Medicare. That's an email I just got the other day from Medicare. This is the facts. this is the conversation to have. So what can we tell them they can do? Because we're not looking to scare them. We're looking to educate them, right? We're looking to reassure them. We want them to see us as the go-to person to help them solve these problems they're going to have anyway. So make sure you stay at home. How often are you going out of the house? One of the things you can do to prevent yourself from getting the COVID-19 is to stay at home. I know you've heard a lot about washing your hands. Well, we're told us to wash our hands for a full 20 seconds. Do you use cold water or hot water when you're washing your hands? See, I can have that conversation with everybody, and they will have that conversation with me because they're concerned. Avoid close contact. They talk about 6 feet. 6 feet's about 2 arm lengths from people who are sick. So maybe you're like some of my neighbors who go out in the yard and we wave at each other. My neighbor came over to my house on what's today? Tuesday? Wednesday. My neighbor came over to my house on Monday. My wife and I were sitting outside. We picked up some pine cones, and he stood at the end of the driveway. We were in the middle of the driveway, and we talked to each other because we kept that distance. Clean and disinfect frequently. So when you bring your mail in, make sure that you pick that mail up with a paper towel because you don't know who's handled that mail. Have a can of Lysol out in your garage and spray it before you bring it in the house. Avoid all cruise travel. I hope you don't have any cruises planned. From what I hear and what I see on the news all the time, it's really dangerous for you. And of course, you need to call your healthcare professional. Let me tell you how that works with the plan you design today. Bam. That's the conversation you want to have with them. And there's things people can do. If they talk to you about this or bring up to you that they're really stressed out or they're just trying to cope with it, and then you're going to hear that from a lot of your prospects. In fact, when I open the call up, I'm going to let you tell me what you're hearing. When people tell you they're coping, you know, I get what you're saying. One of the things that I've told my relatives and my clients is take a break from watching that TV and reading the news and listening to the news. We already know what's happening out there, and we don't need to be reinforced every day that there's problems. What we need to do is we need to nurture ourselves because this too will end. Just like all the major illnesses that have happened over time, it will end. Give yourself a break. Take care of your body. If you're self-quarantining yourself, if you're keeping yourself at home, take a walk around your house. You know, talk to them about the things that they're doing. Make time to unwind. What kind of activities do you like to do? What kind of things give you relaxation? Do you play Monopoly? Do you play cards? Take some time to unwind. Call your healthcare provider if stress gets in the way of your daily activities. And then here's suicide, abuse, and mental health 800 numbers to be aware of. They can text, talk with us at 66746 to get assistance. We want to make sure that we come across to people in a way they need us to come across for people. So what's the sales professional's message? The truth is, the truth isn't the truth until people believe you. And they can't believe you if they don't know what you're saying. And they can't know what you're saying if they don't listen to you. And they won't listen to you if you're not interesting. And you won't be interesting unless you say things imaginatively, original, and freshly. I got a script. I think this is a voicemail script. Armando sent it to me. Armando, I hope you don't mind me going through it here. The reason I want to go through it on this call is I actually thought it was very good, Armando. I thought you did an excellent job on this. So can you share with me, is this something you've been using? Is this something that you drafted up after we started doing this? Tell me a little bit about this.
Mr. Lloyd, I'm sorry. Armando, he just took off in a little bit because he have an enrollment to do.
Oh, okay, yeah. Okay.
I'm sorry.
Well, no, that's good. Let's kind of walk through this real quick. He should go out and make his money, man. That's what we need to do. That's what we're in the business for, right?
Correct. That's right. He asked me. I was expecting this call already for him. So, like a few seconds ago, he took the call already.
All right. Well, we're recording it, so that's fine.
Okay. Thank you.
So I like it. He says good morning. Now We talked before about using the last name. I know we do that because we think that's being professional. So let me just ask you guys a question. If someone calls you up and says, hi, can I speak with Armando Ramirez? How many of your family, friends, or relatives call you up and ask to speak to you by your first and last name? Nobody, right?
Mm-hmm.
And if they do, who do you know they are? A telemarketer. So just finish the sentence. Good morning, Mr. Rawl. My name is Armando Ramirez. I'm a salesperson, and I'm going to try and sell you something. Of course, we're not going to do that. So remember habits. I get saying I'm a licensed agent in the state of, and what you specialize in there. I get that. I would just make that a little informal. So good morning, Bob. Bob, this is John. I'm with ABC Company here in Houston, Texas. We specialize in Medicare plans. I know a lot of my clients receive information about plans and benefits. So see what I did with that little sentence there? Just make it a little bit more conversational. I don't know that I would say I want to guide you, because who's the phone call supposed to be about? It's supposed to be about them, right? I will guide you. So this is a voice message we're leaving. So a lot of my clients are concerned about the benefits and making sure that they get the benefits that meet their needs. That's not a bad little sentence. But I don't even know why we need that in there. I like the idea. A lot of my clients are concerned about paying the lowest cost for hospitalizations, not paying for visits to the doctors and specialists. And of course, they want to make sure that their medication's paid for, maybe even paying $0 or low cost dollars. I don't know how important that is for you. I've got the figures for the plans in your county. Notice where we're at today is the time to start enjoying all the benefits. My number is 865-776-7632. Give me a call back and I'll talk to you about the simplest way to get those benefits. If I don't hear from you by Thursday at 2 o'clock, I'll call you back. Take care, Bob. That's kind of the way I might structure that phone call. Well, here's a couple of things about that. You have to use a phone call that fits your personality. My counsel to you is write out 2 scripts, and if you want to email them to me, I'll play with them and send them back to you. Write out 2 scripts, the one you're using now and one that you think might be differently, and track them. So get 10 full conversations with your current script, get 10 full conversations with a new script, track them, and whichever one you're getting the most response from, that's probably the one you should use. So this is good. I like this. There's a few tweaks you can make about it. So just think about what I talked about there. You use Mr. Rawl, so right away he knows that that you're a telemarketer. Armando Ramirez used his whole name. I would just say Lloyd. I don't have a problem saying I'm a licensed agent. I don't know that I would do all the specialist stuff about that. I think I might let him. I might tell him that later, either later. This is a voicemail, so I don't know if I'd leave that I'm a specialist in it. I mean, is that anything special? Aren't you supposed to be a specialist? And my guess is they probably think you know what you're doing, because most people think an insurance agent already knows what they're doing. But again, I don't know. You have to track it. You have to track it and see. Because I know you received a lot of information. Ask a question. Are you like a lot of my clients? You're getting a lot of information about plans and benefits. That can be overwhelming. I just might ask it as a question or say it as a statement. I know if you're like most of my clients, you're looking for the benefits that are best for you, low cost for hospitalizations, not paying for visits to doctors or specialists, making sure all your medications are paid. Maybe you're looking for $0 or low cost. I like that a lot. I like saying maybe you're looking for $0 and low cost. I've got the plans, the rates for the plans in your county. My number is 865-776-7632. What I have to show you takes about 15 minutes. If we stay on the phone longer than that, because you want to. If I don't hear from you by Thursday, I'll call you back after 2 o'clock. Hey, take care, Bob. I might do something like that. But just play around with it. There is no, I don't care what anyone tells you, there is no magic script. Every salesperson is different and every consumer is different. Remember the other thing we talked about. When you're calling into consumers, you're competing with the noise of their environment, aren't you? So the best script in the world that worked for you in the last 3 sales might do 0 on the next phone call because you're competing with the environment. Let me open the call up to just see if there's any questions or comment. What are you hearing from your people? Is there anything particular you're struggling with? And it's okay if you don't have anything. You don't have to say something if you don't have anything going on.
It's not particular, it's just sometimes a few of my clients are like, well, I'm not going to do anything or change anything or talk about anything until all this calms down.
And what do you do when they say that?
I'd say I'll just, set up a follow-up meeting. I mean, would you like for me to call you like in maybe next month, the beginning of next month? I always say it's very important at least to go over it because, you would like to have something set up in place by the time that your Medicare does kick in. And I just kind of urge the sense of urgency. Just let them know, hey, sticking on original Medicare is going to accumulate many costs. And I know it's not something you want to talk about right now, but I mean, it's something that we should at least set up in preparation so you don't have to, later on. And I try to set it up like at least 2 weeks later or maybe, the following beginning of next month. I don't know if that's what I should be doing or.
What reaction are you getting from people?
They just set up the follow-up. I haven't yet to, reach out to those same people yet.
So they're pretty open to that?
Mm-hmm.
So I think that's smart of you to do that. Every time I talk to you, you're doing smart things. I think that's smart to do that. You're predicting what they're going to be concerned about in the future, and you're letting them know you're going to be available for that. Here's 3 ideas for you in doing that. One of the things I do is validate them. Yeah, and a lot of people I talk to are concerned about that and feel a little bit overwhelmed about the information and what they should do right now. And is that what I hear you saying? Just kind of validate that that's what they're feeling about right now. You're more concerned about keeping up to date on what's going on with the COVID-19 virus so you can protect yourself than you are getting more information on changing plans, right?
Mm-hmm.
Now, the reason I would do that is because that gives me an opportunity to say, as an insurance agent, we work with an insurance company who works with the government all the time, and we get a lot of the latest information. What objection do you have if I send you any updated information as I get it?
Yeah.
And the reason for that is if they agree to that, then we set the expectation with them that they're getting information from us, and it gives you an opportunity, if you have an email address, for example, to email them these updates. Like I get these updates, insurance companies are putting out updates. It gives you an opportunity to email any latest updates to them, and that gives you a reason to open that conversation up. And the third thing you do is give them a day and time that you're going to call. So it sounds like you're doing that. I would give them 2 options and make one of them 2 weeks from the day you're talking to them, and the other one's 4 weeks from the day you're talking to them. Okay. When would you prefer me to call you? A week from 2 weeks from today at the same time, or you prefer me to call you next month at this time? Give them 2 different options.
Yeah.
So, all right, good job.
Thank you.
Anyone else?
Good morning. This is Iris.
Hi, Iris.
Hi. I have a question. When it comes to people saying, I get that all the time when people say, "Oh, I'm okay. I don't need anything. I'm fine, just the way I am right now." So how would you overcome that? Because that's what it's kind of getting harder to me, like to.
So when does that come up in the conversation?
Just like right when I start explaining like what I do and what I'm trying, the purpose of the call.
Yeah. I'm trying to think how I want to say this to you because I don't want to sound mean or anything, but don't explain what you're doing.
Okay.
They're not interested in what you're doing. That's why they say they're fine with what they have, because that's a sales call. It's kind of like when you buy a car and you pull in the dealership slot and you get out of the car and the car salesman comes up and says, "Can I help you?" What do you say to them? You're just looking, right?
Mm-hmm.
And the reason you say I'm just looking is because you don't want to be sold. So don't sell them anything. Give them information. Ask questions about them.
Okay.
So make that phone call. In fact, let's go back to this here. Make that phone call. Yeah, hi, Iris. This is Lloyd Lofton. I'm with ABC Company. A lot of my customers are concerned about the changes taking place with Medicare and how Medicare covers any care they need on the COVID-19. Are you more concerned about your medical costs, your hospital costs, or your prescriptions right now?
Okay.
Give them something to talk about. In fact, the thing about the medical situation going on in this country right now is you can go to Google right now and type in what COVID-19 concerns do seniors have, and you can make a list of 5 or 6 things seniors are asking questions about, and you can open your conversation with that.
Oh.
And by giving people 3 choices, what are you more concerned about? Give them 3 things. Are you more concerned about getting tested? Are you more concerned about getting treated? Or are you more concerned about the medication that would prevent you from getting illness?
Okay.
And see how that will open up the conversation? Because the product and the price and what you do is only relative. It only becomes important if they actually believe they have a problem. And the reason they say, remember the habits training we went through, the reason they say, I'm good with what I have right now, is because that worked with the last salesperson. And my guess is when they say, I'm good with what I have right now, you get off the phone with them, right? That's why they say it. It worked just fine. So that's easy for us to get into that. It's hard to get that doctor mindset. It's hard. It's easy to feel like we're being pushy with people. It's easy to feel like that we're being overbearing with people. And it's hard to get past wanting people to like us and wanting people to not think we're being pushy. It's hard to get past that. Think about when you go to the doctor. You go to Dr. A and you describe your symptoms, and he says, okay, I know what's wrong with you, Iris. You can have this medicine, this medicine, this medicine, or this medicine. Which medicine do you want? Or you go to Dr. B and you describe your symptoms. The Dr. B says, okay, Iris, I know what's wrong with you. He writes your prescription, hands it to you, says, fill that, take it twice a day, come back and see me in 10 days. Which doctor do you have more confidence in?
B, Dr. B.
B, of course. So when you get off the phone, here's an assignment for you. When you get off the phone, before the day ends, don't do it right when you get off the phone because you got to make some phone calls. But at the end of the day, before you leave your desk, take 10 minutes and write down 2 stories with at least 5 sentences of problems people had that the plan you sold them, whether it's a MedSup or MedAdvantage, helped them solve. Write down 5 of them. 5 of them. 5 problems customers told you they had that the plan you helped them buy solved. And then tomorrow, incorporate those stories in a conversation and see if you can extend the conversation. So it sounds like what your goal is to get people to have longer conversations with you, right? So try that out. Thank you for sharing that with me. I appreciate it.
Thank you.
I know that's hard to do.
Thanks.
Any other questions or comments? Your homework for this week is going to be learning to talk about features and benefits. So I'm going to send you this training document, this training ebook. And what it does is it identifies a need. I could use something which would take care of the big expenses of having to go to the hospital. So identify the need. Talk about the feature. Medicare Part A will pay the deductible. But talk about it as a benefit. So notice there's a difference in saying Medicare will pay the deductible, the Part A deductible, and saying, Iris, you don't have to worry. You don't have to worry about taking care of the big things anymore. You don't have to worry about paying the expenses, that $1,408 deductible, Part A deductible. You don't have to worry about that anymore. The plan you designed today will pay all that for you. See, in this booklet here, you're going to learn how to talk about the features as a benefit with people. As usual, you can always email me. Make sure you copy your manager, because I will copy your manager when I respond. You can always reach out to me at my desk number, and you can always reach out to me at my phone. Any other questions or comments before we finish up?
Just a comment. Great class, Lloyd. I get a lot of stuff from the webinar, and appreciate that. And I think all the team is getting putting together all the ideas and put in practice. One thing that I want to tell you is that we increased the sales this week, that everybody's at home. Monday we have a better Monday than previous week, and Tuesday we did great. And the team is, I'm proud of my team. I appreciate your help in putting these ideas, and I think we're going the right direction. I think everybody's learning and applying these concepts.
I appreciate you saying that. Let me tell you something about your team, Juan. You have heroes working for you. And the reason I say you have heroes working for you is not everybody is willing to examine their beliefs, their actions, and their activity in order to find things they can improve on to do better. Not everyone's willing to do that. People's ego gets in the way, their pride gets in the way, their habits get in the way.
Right.
And every one of your team members is willing to look at what they're doing. They're open to hearing new ideas. And the most important thing is they're willing to practice those ideas. They know that when they practice a technique or an idea and it doesn't work, they know it doesn't reflect on them or the quality of salesperson they are. They know it reflects maybe that particular idea didn't work for their selling style. So I think you've got a great team, and I enjoy working with you guys.
Thank you, Lloyd. Appreciate it.
I'm going to email you the homework right now, and then you and I'll talk Friday.